Guys, welcome and welcome back to my channel. If you are new here, my name is Grace Linet. If this is a channel whereby we create awareness on medical conditions. If you are interested in learning matters health, this is the place to be. Kindly subscribe and click on the notification bell so you get updated whenever we upload a video. So today we're going to talk about hypertension. The other name for hypertension is high blood pressure. It's quite common, so I'm sure we've all heard about it. Yeah. Okay, so hypertension is a situation whereby the flow of blood in the arteries exerts high pressure on the arterial walls. Okay, so when this happens, it predisposes you to a number of risks in your body, like complications that we are going to talk about later. Okay, so there is no known cause for hypertension, but we do have a lot of factors that predispose you or put you at a higher risk of contracting hypertension. These include old age, or rather age above 65 years. The other one is existing comorbidities in your body. This is a situation whereby you have other chronic diseases in your body, that like diabetes, kidney disease. All these put you at a risk of contracting hypertension. Okay, the third factor is obesity. This is whereby you do have a body mass index higher than the normal rate should be. Yeah. Okay, so the other one is use of alcohol and tobacco and substance abuse. This also predispose you to a higher risk of contracting hypertension. The other factor is familial history of hypertension. This is whereby we do have people in your family who had suffered from hypertension. So if you are such a person, you are at a higher risk of getting hypertension compared to someone who doesn't have a familial history. The other one is high fat and salt uptake in your diet. Okay, that one is whereby you take so much unutilized fats in your body and uncooked salt, that is lack of physical exercise. You expose yourself to a higher risk of blood pressure. Okay, so that is it for the risk factor. So how do you know you have hypertension, or what are the signs and symptoms of hypertension? Usually it's important to note that hypertension is also referred as the silent killer, mainly because in most patients it doesn't present with signs and symptoms. It's only detected during a routine visit to the hospital, whereby they take blood pressure on the patient and they discover that they are actually hypertensive. Okay, now in the cases where it presents with symptoms, we need to watch out for symptoms like headache, nausea and vomiting, palpitations. This is whereby you consciously hear your heart beating. Also, there is dementia. Some present with dementia. This is forgetting or loss of memory. Another one is weakness or fatigue, general fatigue of the body. Others present with tremors, or rather this is whereby you experience some parts of the body kind of shaking. The other sign that could present with hypertension is chest pains, those among others. Yeah. Okay, so how do we diagnose hypertension? As we said, normal hypertension is measured in millimeters of mercury, whereby we do have two parameters involved. One is systolic, when the heart muscles are contracting, and the diastolic, this is when the heart muscles are relaxing. Okay, so the normal systolic is usually 100 to 140 and the normal diastolic is 60 to 90. So we can, in a summary, we can say that a normal blood pressure should be anywhere between 100 to 140 millimeters of mercury over 60 to also on the management or treatment of hypertension. The first one is, if you are obese or overweight, you want to make sure that you work out your weight to a reasonable level that doesn't predispose you to high blood pressures. Yeah. Okay, the other one is stress management. Also, check on your diet, ensure that you reduce the fats and salts and increase fruits and vegetables in your diet. Also, ensure you take adequate water. The other one is physical exercise. If you are this person who doesn't have a lot of physical activities, you want to make sure your body is engaging in a physical job to ensure that you keep your blood pressure on check. The other thing that you can do is to limit alcohol and tobacco consumption. Also, make sure that whenever you're given medications, you adhere to them accordingly. And that is it about management. What happens if you do not control your hypertension? You are likely to go into the complications of hypertension. These include heart failure. This is whereby the heart is not able to adequately supply blood into the vital organs of your body. The other one, you could get into heart attack. This is whereby blood supply to the heart muscles is cut down or limited. The third one is chest pains due to insufficient flow to the muscles, or rather to the organs, which is called an angina. The other one is irregular heartbeat. This is whereby the heart does not pump in the right rhythm, and it's dangerous as it could lead to death. Yeah, so that is it about hypertension. I hope you've learned the importance of adhering to medications, the supportive treatment, the prevention, so that we can together be able to achieve a healthy generation. Thank you guys for watching. That's all for today. See you in the next one.